எல்லோருக்கும் வணக்கம். சாந்தா ஸ்டேபிள் சந்திப்போமா நிகழ்ச்சியில் மீண்டும் உங்களை சந்திக்கிறதுல எனக்கு ரொம்பவே சந்தோஷம். இன்றைக்கி நாங்கள் முக்கியமான ஒருத்தரை சந்திக்க போகிறோம். சென்னையில் பில்ராத் ஹாஸ்பிட்டல்னு இன்றைக்கி ரொம்ப பெரிதாக இருக்கிற அந்த வைத்தியசாலையை ஆரம்பித்து வச்சவர் டாக்டர் சாய் ரமணன். இவர் இது 1982ஆம் ஆண்டில் ஆரம்பித்து வச்சிருக்கார். இன்றைக்கி அது மிகப்பெரிய ஒரு நிறுவனமாக உயர்ந்து நிற்கிது. அது மட்டும் இல்லாமல் அவர் அப்போலோ ஹாஸ்பிட்டலில் பணியாற்றுறார். அது தவிர மயிலாப்பூரில் ஜெயா கிளினிக்னு தன்னுடைய சொந்த கிளினிக் நடத்தி அதில் அவர் வசதி குறைந்தவங்க நிறைய பேருக்கு பல விதங்களில் உதவி செய்து இலவச மருத்துவ சேவையும் செய்துட்ருக்கார். அவரை பற்றி எல்லாத்தையும் நான் ஆரம்பத்திலே சொன்னேன். எப்படி அவரோட இப்போ நாங்கள் பேசுவோம். வாங்க போகலாம். சந்திப்போமா நிகழ்ச்சிக்கு. வணக்கம் டாக்டர்.
வணக்கம்.
நல்லா இருக்கீங்களா?
Yes, everything is okay. Very nice to hear from Perth.
ஆமா டாக்டர் டாக்டர் நல்லா இருக்கீங்களான்னு நான் கேக்குறேன்.
It looks like you are sitting next to me.
ஆமா ஆமா. எஸ் எஸ். அது மட்டும் இல்ல டாக்டர், இப்ப பாருங்க இந்த சிச்சுவேஷன், இப்ப இந்த கொரோனா வைரஸ் உலகத்தையே தலைகீழா புரட்டி போட்டிருக்கிற இந்த சமயத்துல இப்படி உங்களுக்கு பக்கத்துல உட்கார்ந்து பேசுறாப்புல உங்ககிட்ட நான் ஒரு கிட்டத்தட்ட ஒரு 1 hour நான் பேச போனேன்.
இந்த அளவுக்கு பேச.
ஆமா, ஆனா நான் நேரடியா சென்னை வந்திருந்தா உங்களை பார்க்க கிடைச்சிருக்குமான்னு கூட எனக்கு தெரியாது. ஏன்னா அப்படியான சில நல்ல விஷயங்களும் இப்ப நடக்குது. சோ நாங்க சில விஷயங்களும் பாசிட்டிவாவே எடுத்துக்குவோம்.
If you take everything positive, everything will be positive.
That's
so there is no negative in the world.
ஆமா, நிச்சயமா.
For example, the lockdown nala world has again recreated itself, the nature.
That's
so true. There is some positive always. There is never only negative.
ஆமா. இந்த உங்க கூட இந்த இன்டர்வியூ கலந்துரையாடல் ஆரம்பிக்கிறதுக்கு முதல் நான் ஒரு விஷயம் நான் சொல்லிக்க விரும்புறேன் டாக்டர். இந்த உங்களுடைய இந்த வைத்திய துறை, அதாவது டாக்டர்ஸ், நர்சஸ், அப்புறம் இந்த ஹாஸ்பிட்டல்ல வேலை செய்யற பலர் எல்லாருக்கும் முதல்ல நான் தலை வணங்கி ஒரு நன்றி சொல்ல கடமைப்பட்டிருக்கேன். ஏன்னா இன்னைக்கு உலகம் பூரா, ஆமா இன்னைக்கு உலகம் பூரா தன்னுடைய சொந்த நலம் பார்க்காம மத்தவங்களுக்காக உழைச்சுக்கிட்டு இருக்கிறீங்க எல்லாரும். அதனால உங்களுக்கு முதல்ல என்னுடைய நன்றி, வாழ்த்துக்கள்.
தேங்க்யூ.
அப்புறம் டாக்டர், நீங்க நான் கேள்விப்பட்டிருக்கேன், நீங்க 1982ல ஒரு ஹாஸ்பிட்டல் ஒண்ணு நீங்க ஆரம்பிச்சீங்க இல்லையா?
எஸ்.
ஆமா, அத பத்தி கொஞ்சம்
ஆக்சுவலா அந்த ஹாஸ்பிட்டல் டாக்டர் கே ராமூர்த்தின்ட்டு வாஸ் a very senior surgeon. அவங்க ஆரம்பிச்சாங்க. அவங்களால நான் also joined as a partner. And it was backed by then famous actor Sivaji Ganesan. So he also backed in a big way. And it was one of the first multi-speciality hospitals on the period.
Okay.
And at the time, many of the senior doctors at that point of time, and some of my classmates like Jagannathan, who was a famous gastroenterologist, is no more now. They all took a liking, and then we developed it. Now, once I developed that, I went to US. So I sold the majority share to the other people and kept a minority share.
Okay. So
I was in US for about 5 years.
Okay.
Worked at Hammond Hospital in Austin, Texas.
Right.
For Gulf-based medical services. Gulf, they were taking oil, Gulf of Mexico. So I was doing the medical services for them. And then I returned to India. I became the chief of medical services for ONGC at Juhu Heli Base. And there I took a liking to what you call medical evacuations by air or fast medical evacuations in the golden hour. So I became a specialist in that, and later on I finished my postgraduate fellowship in AeroMedical services with the University of Surrey under Professor Terry Martin. Therefore, what happened was I was a AeroMedical specialist as well as a general medicine specialist. So with this in view, many of the hospitals took me into their fold as a consultant physician. For example, St.Isabel's from 1985 or 87. And then on later on, I also joined Apollo Hospitals as their consultant. To this day, I am working with them.
Yeah, with the Apollo Hospital.
I also started my own clinic, JAYA clinic. So whenever I was not there, it was followed up with other doctors. But it has been running from 1984 till date without closing for a single day.
Yeah.
Whether I was there or I wasn't there.
I have heard about it. In the JAYA clinic, it's in, I think it's in Mylapore. Yeah.
Yes, yes.
Mylapore.
Yes. Yes.
மயிலாப்பூர்ல நீங்க நிறைய சோஷியல் ஒர்க் செய்திருக்கீங்கன்னு நான் கேள்விப்பட்டிருக்கேன். அதாவது அங்க இருக்கிற ஏழைகளுக்கு எல்லாம், குறிப்பா அந்த பாபாவுடைய கோயில் இருக்கு இல்லையா மயிலாப்பூர்ல, அதை சுத்தி இருக்கவங்களுக்கு எல்லாம் நீங்க தான் ஃப்ரீயா எல்லா ட்ரீட்மெண்ட்டும் கொடுக்குறீங்க, மெடிகேஷன் கொடுக்குறீங்க, எல்லாரையும் நிறைய கவனிக்கிறீங்க.
சாய்பாபா கோயில்ல I only started the dispensary there, free dispensary there, way back in 1985. Worked there for 1 year and then started it up. Okay. But I told them, any major cases you have, send it to my clinic, which is about three buildings away. So this is one of the very few clinics in Chennai having 36 years of non-stop service. Even during the tsunami, it was working. Even during the Varda fuel, it was working, and it was working throughout during the lockdown also.
Oh, so happy to hear that. நீங்க இப்ப இந்த கொரோனா வைரஸ் இருக்கிற இந்த சமயத்துலயும் கூட நான் கேள்விப்பட்டிருக்கேன் என்னன்னா, நீங்க கண்டினியூஸா ஒர்க் பண்ணிருக்கீங்க, ஈவன் ஆன் சண்டே. அதுக்கு தேவையான அந்த கியர் எல்லாம் நீங்க போட்டுக்கிட்டு, நீங்க எதுவுமே ஒரு டைமை வேஸ்ட் பண்ணாம நீங்க எல்லாருக்கும் நிறைய ஹெல்ப் பண்ணிருக்கீங்கன்னு நான் கேள்விப்பட்டேன் டாக்டர். இதெல்லாம் நான் கேள்விப்பட்டதுக்கு அப்புறம் தான் நான் உங்க கூட பேசணும்ன்றது நான் உண்மையிலேயே ஆசைப்பட்டேன். இப்ப இந்த வைரஸ் பிரச்சனை சென்னையில நிறைய நாங்க நிறைய நியூஸ் கேள்விப்படுறோம். நிறைய பேர் இதுல எஃபெக்ட் ஆகுறாங்க, ஹாஸ்பிட்டலுக்கு போயிட்டே இருக்கிறாங்க. ஸோ இப்படி எஃபெக்ட் பண்ணப்படுற எல்லாருக்குமே ஹாஸ்பிட்டல்ஸ்ல எல்லாம் இடம் இருக்கா? இப்ப
ஆக்சுவலா இப்ப இது எப்படி ஸ்ப்ரெட் ஆகுதுன்னு we are not knowing it. First thing. Second thing, பீப்புளுக்கு அந்த சீரியஸ்னஸ் இப்போதான் ஒரு 4-5 நாளா தான் வந்திருக்கு. ஏன்னா அதர்வைஸ் அவங்க என்ன நினைச்சுக்கிறாங்கன்னாக்கா, எத்தனையோ வியாதிகள் வந்திருக்கு, எத்தனையோ வியாதிகள் போயிருக்கு, அதை பத்தி ஏன் நம்ம கவலைப்படணும்ட்டு ஒரு ஃபீலிங் இருந்துச்சு. பட் இந்த கொரோனா டிஃப்ரெண்ட் டைப்பா ஆக்ட் பண்ணுது. எப்படின்னு சொல்ல போனாக்கா, சில பேருக்கு நல்ல எக்ஸ்போஷர் இருந்தா கூட ஒன்னும் ஆக மாட்டேங்குது, சில பேருக்கு எக்ஸ்போஷர் இல்லாமயே வருது. Therefore, எனக்கு தெரிஞ்சது என்னன்னாக்கா, எதிர்ப்பு சத்து இல்லைன்னா ஜாஸ்தியா வருது, எதிர்ப்பு சத்து இருக்கிறவங்கள it is making them all right. Even among doctors, if certain doctors are not able to go through the rigors of doing a corona service, that is because they may have some other complications like diabetes or some other problems.
Yeah.
So நான் என்ன சொல்றேன்னாக்கா, it is not about the service or anything, but first and foremost, people must realize that we are responsible for our life, and therefore we have to take care of our life. It's not talking about the Prime Minister, not talking about the Chief Minister, or complaining that they have not done, this person has not done. What we can do.
Yes.
அந்த காலத்துல கண்ணதாசன் சொன்ன மாதிரி, நாடு என்ன செய்தது நமக்கு, நீ என்ன செய்தாய் நாட்டுக்கு கேட்டிருக்காரு இல்லையா? அதனால that is a very apt word now.
Yeah,
because what we are doing for the nation, first question நம்ம கேட்கணும். What nation is doing for us is the second question. Nation is doing so many things, but nation can't do for everybody.
Yeah.
Because as a nation we are overpopulated. One of the major things I used to bring about to my patients was, we have to have self-control among the younger generation to reduce the population.
Yeah. Yes. Yeah.
Because people are not realizing that the nature or the earth can only support this much. And we cannot compare ourselves with China or US. Their landmass is about 5 to 6 times ours.
Yes.
And they can do so many things, but we cannot do so many things. Therefore, it is up to us to have self-restraint and reduce our population voluntarily.
ஆனா டாக்டர் பாருங்க,
now the next generation will be in problem.
Yeah. இப்ப பாருங்க, இப்ப சைனா, அமெரிக்கா எல்லாம் எடுத்துக்கிட்டாலுமே கூட பெரிய ஏரியாவா இருந்த என்ன, எவ்வளவு டெவலப்டான கண்ட்ரிஸா இருந்தா என்ன, அங்க எவ்வளவு பாதிப்பு ஏற்பட்டிருக்கு பாருங்க. அந்த 2 கண்ட்ரிஸ் தான் முன்னால, இட்டலி, இவங்க எல்லாம் தான் ரொம்பவே பாதிக்கப்பட்டாங்க. சோ இதுக்கு என்ன காரணம் நீங்க நினைக்கிறீங்க?
பேசிக்கா China pati we don't know, because a lot of things are kept secret about that country. But as far as US is concerned, there are 3 main factors. One is their culture of moving with people are slightly different compared to our culture. Ennan sollaponaka, the normal culture of shaking hands, being a namaste.
Yes.
Second, hugging is a normal thing when you meet a person after a long time, or when you part from a person after a long Third thing is, when we have the kissing is a normal part of life.
Yes.
Between a father and a daughter, father and a son, or between mother and father, daughter, not necessarily among a husband and wife or lovers. Even kissing is a normal part of their life. Whereas in India and certain Southeast Asian countries, அது கிடையாது. Therefore, what happens is, or infection spreads faster than here. So, in their country, that is the culture and that is acceptable. Even Indians, we are doing the same thing. Even in Australia, we do what Australians do. Yeah. But in India, that culture has not developed to that extent, and therefore the spread of the infection has become less.
Yeah.
That's what I feel.
Yeah, yeah.
That's the reason.
இப்போ ஆஸ்திரேலியால கூட இப்ப அந்த அளவுக்கு ஆஸ்திரேலியால பாதிப்பு இல்ல. ஏன்னா because
they are more restrained than Americans. Yeah. Oh, yes. In their way of life.
Yes.
Moreover, pubs are there, then discotheques are normal in a weekend. Whereas we move people whom we don't know, and they themselves don't know they are carriers. Once it has come in a big way, the country was not able to manage, because nobody will ever have about 300 million testing kits. Nobody will think of manufacturing 300 million testing kits. Yeah.
Yeah.
Only thing is, now instead of buying manufacturing jets, I would say go in for welfare of the people. Not for US, for any country. That includes India also. Welfare is lacking in all the countries. Yeah. Medicine is kept slightly second to acquiring military gadgets. But suppose we get this type of gadgets for medicine, probably a strong population will be a deterrent for another country from invading us. Because a strong population will also be a happy.
Yeah.
Difficult for invading us.
Yeah. So நீங்க நினைக்கிறீங்களா இதுக்கு மருந்து கண்டுபிடிச்சிருவாங்கன்னு நினைக்கிறீங்களா? அப்படி கண்டுபிடிச்சா அது எப்ப வரும்?
இல்ல, ஆக்சுவலா ஸ்பீக்கிங், ஐ ஹாவ் ஒரு ஐடியா எப்படி வந்துச்சுன்னா, ஜஸ்ட் ஐ in the infectious disease journal, where what we have done is we have done a post-mortem of the COVID victims,
right,
in India. Whereas US they did a post-mortem against the orders of the WHO, because the WHO first didn't want a post-mortem to be done and the bodies to be disposed of. But whereas some people in US did it, because this is a very independent country. Hospital also did a what we call a post-mortem. What they have found is, it's very interesting. See, when we do a postmortem, we have found out that a person first suffers from hypoxia. Hypoxia and salapanaka, what is the oxygen that is dissolved in the blood?
Okay.
Adanalda, he is getting a breathing difficulty.
Sorry.
The pneumonia comes next. But
Okay.
what people thought was, they went in for an X-ray of the chest and thought it was pneumonia, started on antibiotics, and if that antibiotics failed, went in for ventilators. But actually speaking, they missed 2 or 3 points in the circle. Basically speaking, what the virus, when it starts, it comes to the outer layer of the cell and waits there. When it waits there, what happens is, it is absorbing all the oxygen, and therefore the dissolved oxygen of the person goes down.
Okay.
Therefore, what happens is, he gets 2 symptoms. First symptom is, he is feeling a little bit breathless when he is climbing stairs, or
Okay.
he feels breathless even when he is walking. So what we do is, immediately we say, okay, you take this medicine or that medicine, it could be pneumonia. See, there will be patchy pneumonitis in lot of people because of the pollution.
Yeah.
So patchy pneumonitis cannot be told that it is pneumonia, full-fledged pneumonia. So what we should have thought was, now it has been done, now it is a protocol, but when it started, it wasn't a protocol.
Yeah.
Now what happens is, we do the SpO2 testing, which is a very simple testing. So SpO2 will be below 85, means obviously is hypoxic.
Okay.
Then what happens, when he is hypoxic, the liver enzymes also fall down. Therefore, SGOT or alanine transferase also falls down. And falls down means the production falls down. To keep up the production, the blood level of alanine transferase increases, and therefore when you test him, he will be showing a very high level of SGOT or ALT.
Okay.
So the 3 points would be to check his temperature, which will come the last. First is hypoxia, second is increased alanine transferase, and third is mostly temperature is high, the last. Second is alanine transferase and hypoxia. So 3 things. If these 3 things are, as I say, high transferase, low SpO2 and high temperature, definitely you can think in terms of COVID.
Okay.
Whereas others, you cannot think in terms of COVID, it could be a normal infection. That is one point. Second is, we always thought of going for the lungs. But even before going for the lungs, suppose we start with high pressure oxygen, otherwise called hyperbaric oxygen. Then what happens? These cells of the COVID virus are displaced from the mitochondria. Otherwise, they go into the mitochondria. When the hypoxia is there, the cell wall opens up, and then they go into the mitochondria. At that point of time, there is a storm known as cytokine storm, and that is the storm which is causing the temperature.
Okay. So when they get to the
therefore, when the temperature is increasing, if you attack it, and there the role of hydroxychloroquine comes. Hydroxychloroquine is able to attack it at the cell level, mitochondria. But it cannot attack later. That is why it is given.
Once they get to the 3rd stage, வந்துட்டாங்கன்னு சொல்லுங்க. அப்படி வந்ததுக்கு அப்புறம்
hydroxychloroquine won't work.
So
it becomes full-fledged pneumonia, and we have to treat the pneumonia with the ventilator. Therefore, stage 1, stage 2, and stage 3.
Yeah.
What I said was stage 1. That is, we are caused SpO2 loss, and the COVID virus has gone into the cell membrane and into the mitochondria. There you try to stop it by giving hyperbaric or 100% or 150% oxygen. as well as give hydroxychloroquine with some antibiotic.
Okay.
Then you will be able to stop it at stage 1 itself. But if you fail to do that, or if the person fails to come at that time, then what happens when it damages the cell, it causes extensive intravascular thrombosis. And when it causes extensive intravascular thrombosis, it causes multi-organ failure.
So it cannot be cured. At that stage, it cannot be cured. Apriya.
Yeah, on the stage we can cure it. What we can do is, at that time, what we do is, when it comes to intravascular thrombosis, then comes the role of remdesivir or flavipar, because these AIDS drugs, that is, these drugs were used for immune deficiency syndromes. When it is injected into the system, it reverses the coagulation profile by attacking the virus. The coagulation profile, there are 12 points in a coagulation. Coagulation, how the blood becomes thicker.
Okay.
So the thickening of the blood and blocking of the vessels and the heart, as well as the lungs.
Right.
The blocking of the vessels or microvascular circulation of the lungs brings about the patchy pneumonia. The pneumonia is not coming because of the bacteria. It is coming by the back door. It is coming by the back door. Therefore, this second stage of the intravascular coagulation and thrombosis should be addressed immediately by doing a coagulation profile, also a CRP and a blood count and a smear. And then we have to administer the antiviral drugs, remdesivir or flavipar. And also we have to administer an antibiotic because there will be a concurrent infection. That's a parasitic infection will be there along with the thrombosis. Because the antibiotic or the bacteria are not killed by the blood cells, because white blood cells and red blood cells become inactive. Then what we do? Then only comes the plasma therapy. Then we throw the blood, give the new blood. And the new blood is from a person who had already suffered from COVID. And therefore, he is having antibodies against the COVID. His plasma is injected into this man. And therefore, the antibodies will will stop the intravascular coagulation. And that is known as plasma therapy. But way back in 2008, we have done a study on a Russian patient, Ivan Sergey. At that time, there was no COVID, but he had a similar type of infection. We didn't know whether it was COVID or not, but we did a plasma therapy. There what we did was, we treated him first, got his blood, and then after 1 month, we injected back the same blood. That was plasma therapy on the same person. Whereas now, we take the plasma from a person who was recovered from COVID and then injected it to him, and that is known as the plasma therapy.
It's so much. It's very hard to understand also. But அது புரிஞ்சுக்கிறதே ஒவ்வொருத்தருக்கும் கொஞ்சம் கஷ்டமான ஒரு விஷயம் தான். ஏன்னா நீங்க அதுலயே அப்படியே ஊறி போய் இருக்கிறதால உங்களுக்கு இவ்வளவு ஈஸியா அதெல்லாம் வருது. பட் டாக்டர் இப்படி சொல்றாங்க இல்ல, டயபிட்டிஸ் இருக்கிறவங்களுக்கு இது எஃபெக்ட் பண்ணுன்றாங்க. So what's the reason? என்ன காரணம்?
Not only diabetes and diabetes மட்டும் இல்ல, any other CKD, chronic kidney disease, or any other similar problems like liver problem, like cirrhosis, alcoholic. What happens is that his immunity is not 100%, but it will be only 50%. Therefore, what happens is, when the cells, when the virus comes into the system, it is able to get into the cell very fast.
Okay.
Much faster than we could anticipate. For example, the incubation period of the virus is 14 days.
14 days.
The incubation period in a person of a severe diabetic or some other condition would be 6 hours. And 6 hours is very less a time to understand or diagnose. That's why most of our deaths are diabetics.
All right. Okay. So the diabetic people should be very careful.
Please stay at home and increase your immunity. And if you have a problem, please come immediately to the hospital. Personally, left to myself, what I would do is, when a diabetic comes with fever or some other similar symptoms, we immediately transfuse him 2 units of plasma and give him 150% oxygen, whether he requires or not, within the first golden hour of 6 to 8 hours. Then we can save him. But if it becomes 24 hours, the cytokine storm comes, cells open up, and if more than 50% of the cells open up, we cannot get it corrected. We can correct in the initial stages when only 10% open up.
Sorry.
Then what happens? He gets in extensive internal bleeding. So he dies. Or he gets a hemorrhage in the brain. So this is the pathophysiology of COVID.
So the hemorrhage என்றது வந்து it's like என்ன மாதிரி அது வரும்? அது வர்றப்ப வந்து இது ஸ்ட்ரோக் மாதிரி வருமா? இல்லனா எப்படி?
It is a stroke actually.
Stroke.
It is a stroke, but stroke is caused by high blood pressure or some bacterial infection. Here it is caused by this particular virus known as COVID.
Right.
Whereas in normal stroke, what we do, we give the antibacterial medicines. Teglitipin, so many others are there available which give. But whereas here, we are not having an exact medicine to give in the 3rd stage. The problem is now at the 3rd stage. The 1st stage, hydroxychloroquine. 2nd stage, antivirals and plasma therapy. But 3rd stage, what do we do? Sit and watch him die. So the research is now focused on the 3rd stage.
The other thing is, on the second time, இப்போ ஒரு ஆளுக்கு வந்து கோவிட் வந்து அவங்க வந்து குணமாகி இன்னொரு தடவை செகண்ட் டைம் வந்துச்சுன்னா, இப்ப சைனால எல்லாம் செகண்ட் ரவுண்ட் வந்திருக்குன்ற மாதிரி நாங்க கேள்விப்படுறோம். So அப்போ what will happen?
Yes, that is a new point that has come up, whether it is coming for the second time. But that is a debatable point because normally a virus finishes off itself. That means there is no residual virus left back. Unless we are thinking in terms of a mutant, which we are not aware of so far. If it is a mutant and part of the virus is shed as a mutant and stays back in the spleen or liver, then it could come for a second time. But this is a hypothesis and the research is just going on and we don't know about it. And mutation of a virus is a very dangerous thing. But normally we have seen, as far as Ebola is concerned, as far as SARS, mutant. Therefore, we feel whether it could be man-made sometimes. As a doctor and a scientist, it is baffling.
இப்போ டாக்டர் நீங்க வந்து so you are doing western medication, allopathy medicationல தான் நீங்க எல்லாம் செய்து போயிட்டு இருக்கீங்க இவ்வளவு வருஷமா. So do you believe in ayurvedic medication? இந்த மாதிரி கோவிட்க்கு வந்து ayurvedic medications
are same. All medications, like all religions, are same. They lead to the same God, the same supreme. All medications are same and lead to the same effect. Whether it is Ayurvedic, Unani or homeopathy, the formula is the same. The formula is go into the cell, go into the mitochondria, break down the virus, bring it out, reconstruct the cell wall, and make it more potent so that more virus cannot come inside. This is the basic formula. The basic formula is put into different uses in Ayurveda, this thing, like in religion. You go to Balaji, somebody goes to Allah, somebody else goes to
Buddha.
Jesus Christ. Buddha, Jesus Christ. But then the Supreme is the same.
Yeah. Okay.
And that is why I believe in Sai Baba when he said the Supreme is the same. You follow any religion you want.
Yeah, that's true.
So,
yeah.
Medicine. As a doctor, I have used Ayurveda, I have used homeopathy in my practice. Because the end point is the same. The working formula is the same.
Okay.
Even the chemical is the same. Because in the sense we use an artificial chemical, they use a natural chemical. But the work is the same.
Okay. So, either இப்ப ஃபாஸ்டா ஆக்ட் பண்ணக்கூடிய மெடிகேஷன் எதுன்னு நீங்க நினைக்கிறீங்க? வெஸ்டர்ன் மெடிகேஷனா அப்படி இல்லனா ஆயுர்வேதம்?
என்னுடைய ஒபினியன்ல ஃபாஸ்டா ஆக்ட் பண்ணக்கூடியது to increase the immunity will be vitamin C and zinc along with good nutrition food, and in the chloroquine as of now, antiviral and anti-AIDS medications like remdesivir or Flavipar, along with plasma therapy or blood transfusion. And in the third stage, of course, we have to have the help of God also, and also go about with these medications, hoping that the virus will come down.
So zinc ன்னு சொல்றீங்க டாக்டர். ஜிங்க்ன்றப்ப வந்து நாங்க என்ன ஃபுட் எடுத்துக்கிட்டா அதுல ஜிங்க் இருக்கும்?
ஃபுட்ன்னு எடுத்துக்கிட்டீங்கன்னாக்கா all green vegetables,
okay,
even kirai has zinc.
Okay.
Basically speaking, if you are not having a junk food, what is junk food? Junk food is a food which is devoid of the vitamins. And that is devoid because of overheating or overusing of microwave oven to create a taste. The same food would not have a taste if you are not doing all these things.
Yes.
For example, a finger chips is tasty because it is coated over the potato and is having a olive oil. Whereas the same potato, if it's taken after putting it in a boiling water, it is not tasty, but it is more effective.
Yes.
Whereas finger chips is tasty, but less effective or not effective.
So extensive use of microwave ன்னு சொன்னீங்க. So microwave வந்து அளவுக்கு மிச்சம் பாவிக்கலாமா கூடாதா? அதுல என்ன வரும் அதனால?
Actually speaking, we have not done much research on that. Therefore, we should not come to very fast conclusions. But one thing which we feel is when we use microwave to reheat again and again, every time we heat it, the number of potency factors in a particular food, be it vitamins or be it carotenes, be it antioxidants, are getting evaporated.
Yes.
Or destroyed. That is why we say cold salads are better than cooked food.
Yes.
The basis behind that is the destruction of the components inside the food. If the components inside the food are all right, then we get it absorbed.
Yeah.
But we won't have the taste.
Yeah.
Therefore, every individual in the world must become a Mahan. Then they will understand the value of food.
Yeah. Yeah, that's true. That's true. And இங்கெல்லாம் இப்ப இந்த வெஸ்டர்ன் கண்ட்ரீஸ்ல எல்லாம் நிறைய salads எல்லாம் நிறைய சாப்பிடுவாங்க. They eat a lot of eat junk food
in
also.
Fact, in Western countries they do both. They take junk plus salads.
Yes. And also
that's why they are able to balance the health. Whereas in India, many of our younger generation go in only for junk because most of the salads are not that easily available here.
Not available.
In the sense
that's
in the hotel. the hotels. But we can make a salad from the shop. Buy tomato, buy cucumber, buy everything and make it into a salad, which I was doing during the lockdown period. Even when I was on duty, I used to buy this and then make a salad and take it with the bread. Because I always felt idli in the morning, idli in the night and some rice in the afternoon keeps a boy healthy.
Okay.
Whereas biryani in the afternoon and naan and curry in the night makes a boy a bad boy.
That's true. Even whenever I come to India, நானே நினைப்பேன் இவங்க வந்து இந்த salad vegetables வந்து அங்க இல்ல பத்தாது இருக்கிறது. So why don't they try to grow? ஏன்னா இப்ப அந்த ஊட்டி பக்கம் எல்லாம் நிறைய salads எல்லாம் போட்டா நல்லா வரும். அது என்னன்னா அந்த பழக்கத்துல வரல. அதுதான் ரீசன் நான் நினைக்கிறேன். பழகல.
Basically, madam, we have to popularize the value of the salad.
Yeah.
We should not popularize the taste. That's why I used to told in one TV program, many of the chefs are popularizing the taste.
Yes.
But they're not popularizing the value of the food.
Yeah. They should introduce healthy food.
And popularize the value of the food. They say it's the value of work of the nutritionist. I say everybody is a nutritionist. Every mother is a nutritionist. And every wife is a nutritionist. But I don't agree with it because I feel every husband should be a nutritionist.
Yes, true. இப்போதா husbands எல்லாரும் சமைக்கிறாங்களே. In the lockdown period, all the husbands have started cooking.
They are doing it. They must know their job. Knowing their job is not adding oil or anything. Basically, like in MBBS, we must know anatomy and physiology before we start treating the patients. Likewise, they must know the nutritional value of the foods they are cooking.
Yeah, true.
Where the food is coming from. What was the chemical used to bring about the food? All these values, if they know in a little way, then they will be a better cook rather than making a tasty food.
Yeah, and also overcooking. Overcooking is also not very good. Yeah.
Oh, very bad. Yeah. In fact, one of these days you can have in your channel. What's the difference between cooking a nutritious food and cooking a tasty food?
Yes.
And what is the difference? And what a person should do? You can have a program with some of the people in Australia and other countries.
Yeah, because நீங்க என்னோட அந்த சேனல்ல பாத்தீங்கன்னா அதுல இருக்கு நான் நிறைய healthy food நிறைய போட்டுருக்கேன். Because I use lots of vegetables. நிறைய vegetarian recipes இருக்கு இன்னும் நிறைய வரும். But I've just started. இப்பதான் ஒரு ஸ்டார்ட் பண்ணி ஒரு 8 months தான் ஆகுது இந்த சேனல். So
I'm a vegetarian from the beginning, and I feel vegetarian food itself has got more nutrition than any non-vegetarian food if you choose the right vegetables for the right period.
Yeah.
For example, we have got lot of grains, lot of salads, lot of fruits, and curd, dal. So there's nothing to beat all these things.
Yeah, true.
And Italy is a world famous nutrition specialist by itself.
True. இப்ப டாக்டர் நீங்க so if you say இப்போ இந்த வைரஸால எஃபெக்ட் பண்ணப்பட்ட ஒருத்தர் இருக்காங்க அவங்களுக்கு what kind of food would you suggest?
Those who are affected by the virus naka, they must be careful in the food. Why naka? The virus can get into the intestinal system also and cause some hemorrhage or ulceration or gastritis.
Yeah.
Therefore, before they are affected, they must have a nutritious food, whether it is vegetarian or not vegetarian. But when they are affected, then a bland diet is most important. And the salt content should be balanced after doing the electrolyte study of the blood. Because we must balance the sodium, potassium and bicarbonates. Okay. Otherwise what happens is the body may become acidic or body may become alkaline, and both are wrong for the vital organs. So this is known as metabolic balance of the diet.
Okay.
So metabolic balance of the diet will come only by doing the metabolic analysis of the system. And the metabolic analysis comes from the electrolyte study of the blood.
Yeah. அப்புறம் டாக்டர் நீங்க வந்து ஹெலிகாப்டர் எமர்ஜென்சி சர்வீஸ் அதுல வந்து
as I told you, I became a chief of ONGC. Yeah. So I used to do a lot of evacuations from the Bombay High to the heli base, and from them take them to the opposite Nanavati Hospital. It's a very famous hospital in Bombay. It was just across the heli base. But then what we were thinking was, we fly for 1 hour to go to the rig, then take him, and it takes about half an hour to transfer him from his MI room to the helicopter, then fly back 1 hour. It becomes 2.5 hours. Then trolley him to the hospital, where the emergency medical officer is waiting and starts all fast work. But already 2.5 hours is lost. That means the golden hour is already lost.
Yeah.
So why don't we bring the ICU into the helicopter and finish it off there? Why wait till coming to Nanavati Hospital? So emergency doctor of Nanavati Hospital, instead of standing in the emergency room, can sit in the ICU ward, so that we will take him directly to the bed in the ICU ward.
Yeah.
And that's how this thought came up. So we started fixing the ICU instruments into the helicopter. And I found out a cheaper way of fixing it, because all these Western countries are offering helicopters at phenomenal prices. Just for the show of it. Like when you buy a Benz car, it is 1 crore rupees. And I got a Maruti for 5 lakhs rupees, which is doing a better work than a Benz car for information.
Yes.
So what I thought was, I'll put the instruments, fix them up with Velcro, which the ISRO and NASA were using it way back. So I got that idea, and we started using a Velcro, which I have patented it myself. And we started this work. And it was working. It was from 2007 to 2010, that type of helicopters were flying. But afterwards, of course, they went in for all these fancy things. But now during the pandemic, I reintroduced the Velcro system, both for the civilian and the military side. And we are now able to do evacuation just like that.
Oh, great.
And we can take which instrument we want. It is like a la carte. You are not having a fixed menu. A la carte. You can fix in whichever instrument you want within 10 minutes.
Oh.
And it has saved a lot of rupees. But when we did it in 2007, when they removed it, they said, no, we have to. Same Prime Minister, different Prime Minister now has written a word of appreciation, telling that it's a good technology.
It's a great service, doctor. So அது மட்டும் இல்ல, நீங்க ஹெலிகாப்டர்ல போய் அங்க நீங்க வைத்தியம் பாக்குறீங்க, அப்புறம் வந்து இங்க நாட்டுல இருந்தும் வைத்தியம் பாக்குறீங்க. Then also you are doing some marine, you are a marine doctor as well, இல்லையா?
Yes.
Yeah. So அந்த அனுபவம் கொஞ்சம் சொல்லுங்க பார்க்கலாம்.
Actually, when I was in ONGC, you are not only a helicopter doctor, you are also a marine doctor, in the sense you have to go into the platforms, you have to go into the marine ships, or go into the tankers carrying the oil, because all of them would have some emergency or other.
That's true, Amma.
Isn't it? Therefore, what happens is, we also become a marine specialist.
Right.
But when you become a marine specialist, it also means that all the ONGC rigs will have a marine crew, will have a petroleum crew, will have a helicopter crew. But last but not least, you are fixing a pipe at the bottom of the ocean, and therefore you will be having a diving crew.
Oh, okay.
That is underwater medicine. Therefore, if you are not able to calculate well, see, when you fly in the air, we have to calculate the amount of oxygen or amount of gases that the patient would require. When we go underwater, again, there is a calculation of amount of time he has to spend in a cabin to decompress himself, or how much of the gas he would have absorbed when he had gone into the bottom of the ocean. That is the basis of underwater medicine, for which I was trained under Surgeon Commander Idicula at Mazagon Docks in Bombay.
டாக்டர், இதெல்லாம் கேக்குறப்ப எனக்கு என்ன தெரியுமா ஞாபகம் வருது, அந்த விஷ்ணு வந்து இந்த 3 அடியால உலகத்தை அளந்தார்ல, அது போல நீங்க வந்து வானத்திலயும் போய் ஒர்க் பண்றீங்க, தண்ணி கீழையும் போய் ஒர்க் பண்றீங்க, இங்க நிலத்துலயும் இருந்து ஒர்க் பண்றீங்க. You are doing a great job. You're doing a great job.
Actually, the formula is the same, madam. The calculations, basically it is mathematical formulas. When you fly in the air, what is the dosage of medicine? When you are on land, what is the dosage of medicine? When it is underwater and he is brought up, he is under the same pressure that he was in underwater, that is a chamber. And what would be the dosage of medicine in him? Suppose he is ill. So basically it is mathematics.
Mathematics. Okay. Ipa neenga sir, ipa ivvalo,
of course the knowledge must be there. If you have the knowledge, that knowledge has to be converted into mathematical formula to calculate the dosage, otherwise you will be a failure.
Yes. Okay. Sir, ipa neenga vandu doctor varanonu nenechu neenga சின்ன வயசுல இருந்தே என்ன இப்படி ஒரு சர்வீஸ் மனப்பான்மையோட, சேவை மனப்பான்மை, ஏன்னா நீங்க இப்ப நிறைய பேருக்கு நீங்க உதவி செய்யறீங்க. உங்க இந்த ப்ரொஃபஷன் போக வெளியில நீங்க நிறைய பேருக்கு நிறைய உதவிகள் நீங்க செய்றீங்கன்னு நான் கேள்விப்படுறேன். சோ இது வந்து உங்களுக்கு என்ன ஆரம்பத்துல சின்ன வயசுலயே உங்களுக்கு நீங்க டாக்டர் ஆகணும்னு நினைச்சே டாக்டர் ஆனீங்கல்ல எப்படி?
இல்ல, I actually got into first new college la BCom la சேர்ந்தேன். But at that time I had made application for medicine also. Because my father was a professor in a university. He said you also put application, but we didn't have much influence at that point of time. But when they went into my marks and everything, at that point of time they called me for the interview.
Okay.
So reluctantly I put leave for one day in the new college and went for the interview. But in the interview, when the questions they asked, I was able to answer. I don't know how. And they were very impressed. At that point of time, the chairman of the interview was Professor Padmanabhan. He was a very leading physiologist. And I finished the interview. He said, "You are selected." He didn't tell anybody else, but he told somebody you might have told, but he told me. When I came out, my father was standing. We had a standard 10 car at that time. I was sitting in the car. I remember very well. He came inside and said, "What happened? Did you answer? I think you will make a mess of things." As usual, parents, no, they feel we are making a mess of things. In fact, I was doing a mess of things, a lot of things in my school days. No, I said, he said he is selected. What do you mean you are selected? It cannot happen. Don't bluff. He told me you are selected. It was at that. Then we came home. But then itself he had asked, "Who's your father?" and all those things. "Sir, what's your background?" And said that he was a professor in the university and all this. Okay. Then after 5 days, he phoned up my father and said, "I understand that you people are discouraging him in so many things from the day he was born. From your son, I understood that from the interview I had with him.
Okay.
But he's a very clever person. And therefore, you please start encouraging him. And instead of going your way, you go his way." Incidentally, I have put his papers, and Kalanjar Karnanidhi, who was the chief minister at the time, has signed the papers. And he's selected. And you please bring 124 rupees and pay the fees immediately.
Great.
The fees was 124 rupees.
So நீங்க வந்து இவ்வளவு சர்வீஸ் வந்து செய்யணும்ன்றது உங்களுக்கு இருக்குது வருங்காலத்துல. சோ அதுதான் உங்களுக்கு அப்ப ஆரம்பத்துல அப்படியே
வந்து probably my latent talent was not used at the time by when the school, I think, because they were so strict. No, I was a little bit out of box person. They suddenly sometimes go into a thinking type, no, so I don't talk with anybody for an hour or so.
Okay.
Then of course I start writing what I had thought. So in this way, what happens is, even when I see a patient, even nowadays, when I come out of the critical care unit, I just go and sit somewhere. Somebody brings me some coffee and then I drink. Now people have understood. When I sit and start taking a coffee, the patient's relations from far away said, "Yes, thought about it. The patient is going to be all right."
Oh.
That is my way. I don't know, but everybody will say, உக்காண்டாரு சாப்பிடுறாரு காபி சாப்பிடுறாரு கவலையா படாத திங்க் பண்ணிட்டாரு வழி கண்டுபிடிச்சிட்டாரு அவர்.
அது வரைக்கும் நீங்க செட்டில் பண்ண மாட்டீங்க, அவங்களுக்கு குணமாகுதுன்னு தெரிஞ்சதுக்கு அப்புறம் தான் நீங்க ஒரு காஃபியே குடிப்பீங்க. Okay.
I will just think, then I put it. That's my way of doing things. Similar things I did when I was in college. So many other things I brought about. I became a general secretary in the college by election. Then I fought for the house surgeons. They were being paid 150. So I was I went before the bus, slept before the bus. I was arrested, taken. And at that time, Kalanjar Karnanidhi was the chief minister. So he called me to the secretariat from the commissioner's office. He said, what do you want? Why are you now coming before the bus, stopping things and also inciting all the students? I said, with 150 rupees, so much education, other things, what we can do? We can't even buy a good shirt. Even the shirt at that time was 25 rupees. Then he said, how much you want? How much you expect for the house surgeons to be given? I said, at least it should be a decent salary of 500 rupees. Then, like me, he was also, he thought for 5 minutes. Then he said, have your coffee. They brought some coffee. And after the coffee, he said, get up. He called up the director of medical services. Was also sitting in the next room. He said, see, we have to do something for the educated people. I mean, he was a very great politician. See, a lot of issues were there with so many people had so many views. But as a politician, he knew the difficulties of the people.
Okay.
So immediately he said, okay, so you people are all coming from the middle and lower middle classes. So I have decided to give 999 rupees.
Oh.
Okay, sir, thank you very much, I said. Then he said, no, don't thank me. You say you fought for 999 rupees and announce in the press.
Oh.
You don't say, Kalanjar gave 999 rupees. ஏன்னா நான் சின்னவன், நான் வளர்ந்துட்டேன். இப்ப நீ வளரணும். So நீ வளரணும். நீ கஷ்டப்பட்டிருக்க, நீ தான் வரணும். இப்போ நான் வர வேண்டிய அவசியம் இல்லை, நான் வந்துட்டேன் ஆல்ரெடி. So நீ போய் வெளியில சொல்லு, நான் சண்டை போட்டு 999 கொடுத்தேன். So I told the same. Now I am telling you the truth.
Okay, it's great. நல்ல விஷயம். ஏன்னா இப்படி எல்லாரும் இப்படி இருக்கவும் மாட்டாங்க இல்லையா? நீங்களும் அவ்வளவு தைரியமா அவரோட பேசி இருக்கிறீங்க, அதே சமயம் அவரும் அதை ஏத்துக்கிட்டார்ல.
அதே மாதிரி I had a very good experience with MGR also when he was a chief minister.
சொல்லுங்க. At
that point of time when he was a chief minister, I was the casualty medical officer.
Okay.
And there was agricultural riot going on. Narayan Naidu and others. So this problem was going on very badly. Then of course when Narayan Naidu, he said, he didn't tell me, but I told Narayan Naidu, see, there's no point in fighting for agriculture in the city. Because who will understand? We have to fight for agriculture in the districts.
Yeah.
Then only the people will understand. Yeah. So I told Narayan Naidu, sir, see, what is the point in coming to the secretariat, storming the secretariat, not allowing the chief minister to work and other things? Whatever it is, you have to put the points there. And then they have to understand. Nobody has understood, because I myself have not understood an educated person why you are fighting for.
Okay.
How this happened was, Narayan Naidu developed a chest pain. So I was rushed to the central station to see him as he came from the train for Giroing Madras. At that point of time, I treated him and said this. Then I told him, also there is a problem in your heart. He thought I was just telling for the sake of putting him in the hospital, but then I had the power, so I put him in the ICU. And Lakshmikantan, a famous cardiologist at that time, he saw it and said, yes, he has diagnosed a myocardial infarction so fast by keeping a stethoscope, not a ECG. So Narayan Naidu was petrified. So he went and told MGR, this fellow is a very clever person. But MGR kept quiet. Later on, when I got an opportunity to go to America, there was a rule that those who have done the MD should not go to America till they finish 10 years of bond.
Okay.
So I told the director of medical services, his name was John Jessican, if I'm not mistaken. He said, you have to meet the chief minister, I'll get you an appointment. I met the chief minister, he asked me, came, said, I know everything, what you're telling, but you have got a very great opportunity there to be a very good doctor. You learn, come back and do a lot of things for Tamil Nadu and India. And I will sign the papers so that he can go back.
Okay.
Because he remembered who I was through Narayan Swami. How I came to know is, then he asked me, when you can save the life of Narayan Swami Naidu, you can also save the life of every Tamilian. Then I understood what he meant.
Yeah.
Then I said, thank you, and got up. Then he said, sit down. He brought 25,000 rupees and gave it to me. And gave me 25,000 rupees. That's a big amount at the time. Don't think this is a bribe. This is unbaliku.
Oh.
Unbaliku from your chief minister. You accept it.
MGR.
And then I got that. Then I got up. He said, again, sit down. Then he got an Armani suit, gave it to you.
Okay.
Idu nee wear pannano. America. Then only after that, when he became sick, he himself gave the idea of going to US.
Okay.
I would have been one of the reasons would have been myself also. Like that, you must have seen so many people. Because when he knew that I'm going to a college where I could learn so much, do so much, he was feeling that red tape should not come in the way of the person.
Yeah, that's true.
So he was also a great chief minister.
Yeah.
But I didn't have an opportunity to meet him after that. I didn't have an opportunity. Only one time I have met him. I didn't have an opportunity to meet him after that. But the push he has given made me to the second higher level.
That's true.
Because when he became an AB is American board certified, then it's equivalent to more than MD or equivalent to MD. That is a double MD, no? So even central government officials, everybody start respecting what you say.
Yeah. You know, he has helped so many people there.
Please join. Don't bother about the cases. You don't have to have a minimum guarantee of cases. If you come, it would be okay.
That's great. And I put Mr. Kamal Hassan kuda ungala koopittu oru
Kamal Hassan also
idellam
I don't know how to came about it. Then he made me talk. They had a question and answer sessions with this Mayam talks. There I put across the social way of doing medicine. So my idea was, see, you spend 21,000 crores, 30,000 crores on COVID prevention. But the question is, who sees the COVID patient first? It is not the Corporation of Madras or not the DMS which goes house by house and asking for COVID, because nobody is going to tell you the truth.
Yes.
They are afraid of being quarantined. They are also afraid that they may get some other problems. Society.
Yeah.
The family doctor will meet them first, because they would not bluff a family doctor, because they would not know about COVID at all. They would have come with the symptoms.
Yeah.
But the family doctor will know what was the problem.
Yeah.
And when the family doctor knows, if the government can tie up with the family doctor, then they can go to the correct house and do the testing.
Yes.
Without giving away the name of the family doctor. This is like an intelligence. Like police intelligence. You can have 10 jeeps and police jeeps with guns. But unless they know where to go and catch the criminal, so intelligence has to tell them he is in this particular house. You surround it and shoot it. So the intelligence man, the intelligence bureau is the family doctor. But they have not implemented that, because if they attack the family doctors, if they use the family doctors all over India, then they will know where the COVID is spreading, who's having COVID, who's not having COVID, who's having a good health, who's having a bad health, who's 5 months pregnant, who's had an abortion, who has suffered from tuberculosis previously, who's a drug addict, anything.
So why are they doing it?
அதுதான் தெரியல. If they had done that, or if they do it now also, I put it in Kamal Hassan's this thing. Nothing like it. I told in the interview itself, உங்க தலைவர் மனசு வச்சா அத பிரதமர் கிட்ட சொல்லலாம். So the தலைவர் has obviously seen it, because he has already more than that. Yes. So it's not that he may not have seen it, but the question is, either he has not followed this, or he may, because he has not got into it seriously, or if he has followed, probably, I don't know for what reason, because it's a very good point. You don't have to go from house to house, because by going to house to house, you don't gain anything. Nobody is going to tell the truth.
And no one will know, actually.
It has to come from the intelligence bureau.
Virus தானன்றது எல்லாருக்கும் தெரியாது. How do they know? They don't know. Only a doctor will know.
ரொம்ப சோர்ந்து போய் that will give us a good idea. அதை விட்டு போட்டு நம்ம வீடு வீடா போய் நான் டெஸ்ட் பண்றேன்னா எத்தனை வீட்டை நீ டெஸ்ட் பண்ண முடியும்? Unless of course not 130 crore testing kits, okay, you test everybody. But to my knowledge, nobody in the world will have 130 crore testing kits. So the best is to use the family doctor system. In fact, what I am telling probably must have been used by Australia and UK, because they have the national health system, and they must have tapped the national health doctors to find out who's having problem and who's not having problem, and tested them and brought it to a close, even in New Zealand. These three countries, UK, New Zealand and Australia, are following the same system. And they must have tapped into the national health scheme. They must have tapped into the leading physicians there, and all the day-to-day family physicians, found out who are in bad shape, tested them and corrected it.
And also doctor, in Australia, actually the affected people, அவங்க அந்த வெளியில ஃளைட்ல வந்தவங்க, cruiseல போய் வந்தவங்க, இவங்களாலதான் இங்க ஸ்ப்ரெட் ஆனது.
Not in the town itself.
And that's also not much in Perth. Eastern statesல, Sydney, Melbourne, அந்த பக்கம் கொஞ்சம் கேசஸ் அதிகமா இருந்தது. But what they have done is they have controlled it. எப்படின்னா border protection. Even people can't travel from one state to another. போக முடியாது, not allowed. Plane ஓடுதில்ல. அது மட்டும் இல்ல, the social distancing அங்க இருக்கு. அது எல்லாரும் பாக்குறாங்க. ஒவ்வொரு ஷாப்பிங் சென்டர்லயும் அது கவனமா பார்த்துட்டு வர்றாங்க. And also they give them the hand sanitizer. நாங்க கையில வச்சிருக்காட்டியும் கூட அங்க வச்சிருந்து எல்லாருக்கும் கொடுக்குறாங்க. And they are very careful. அதனாலதான் கண்ட்ரோல் பண்ண முடியுமா இருக்கு. இப்ப பாருங்க, நியூசிலாந்துல ஒரு கேஸ் கூட இல்ல இன்னைக்கு.
ஆமா,
it's cleared. நியூசிலாந்து, பட் இங்க ஆஸ்திரேலியால ஒரு few cases are there, but deaths வந்து ரொம்ப குறைவு இங்க. So அப்படியே அந்த அவங்க
basically in a country like India, they must use the family practitioner.
Yeah.
You cannot conquer any disease. For that matter, even tuberculosis or any other pandemic, you cannot cross, because here it is family medicine based. So people will swear by the family doctor. And senior doctors would have been a doctor for the mother, for the daughter, and for the daughter's child also.
Yeah.
And the daughter's child will be 3 years, but she will swear by this doctor.
Yeah.
So we have to tap into family doctor system in India.
Family
Any
doctor
other
system.
method won't work out. And second method, as you said, is stop the airports and the seaports. That is okay. That is also must be done.
Yeah.
And finally, we must be honest in our estimation of a patient's condition, and to our real honest to our conscience, we must make the report. If we do that, everything will be all right.
Thank you so much, doctor. Thank you so much. Thank you very much for your time. நீங்க இவ்வளவு விஷயம் ஒரு 1 hourல நீங்க நிறைய விஷயங்கள் சொல்லியிருக்கீங்க. நீங்க உங்க பிஸி ஸ்கெடியூல் என்னன்றது எனக்கு தெரியுது. நீங்க பேசுறத பார்த்தாலே எவ்வளவு வேலை கையில வச்சிருக்கீங்கன்னு சொல்லி. பட் யூ obliged, to participate in சந்திப்போமா நிகழ்ச்சி. Thank you so much. God bless you. ஏன்னா நீங்க எல்லாம் எல்லாரையும் கடவுளுக்கு நிகரா நின்னு எல்லா மக்களை காப்பாத்திட்டு இருக்கிறீங்க. So God will bless you. Baba bless you.
Thank you, madam. Thank you.
Thank you so
much. Over and out. Thank you.
நிகழ்ச்சி எல்லாருக்கும் பிடிச்சிருக்கும்னு நம்புறேன். இவ்வளவு பல விஷயங்களை தன்னுள்ள அடக்கியவர், இவ்வளவு சேவை மனப்பான்மையோட பணியாற்ற ஒரு டாக்டர். அவர் எவ்வளவு தமாஷா, மனம் லேசாகிற மாதிரி இந்த 1 மணி நேரம் பேசியிருக்கார். இந்த நிகழ்ச்சி எல்லாரும் ரசிச்சிருப்பீங்கன்னு நான் நம்புறேன். பல விஷயங்கள், எங்களுக்கு தெரியாத பல விஷயங்கள் அவர் இன்னைக்கு சொல்லியிருக்காரு. அதால எல்லாருக்கும் ஒரு பலன் இருக்கும்னு நான் நினைக்கிறேன். மீண்டும் இன்னொரு சந்திப்போமா நிகழ்ச்சியில விரைவில் சந்திப்போம்.